again, I think this idea of advocacy is really important. So not everyone is a born advocate. So if you are, then knowing what to advocate for is really important. But if you're not, you don't feel like you can be your own advocate, to find the individual that can come alongside you. But then when you're coming to the visits, come prepared with, there's a few things. Again, you want to let your team know who you are. One of the things that I did with my patients is they could create an actual overview, a summary of who I am, and talk about, again, like what's important to me. I value being an athlete. I value, friendships. I love nature. Write something that really expresses who you are and what you're, and have them put that in the chart. Because now when your physicians and the care team look at the chart, they're seeing a human being, not just a patient. So you always want to make everyone understand you as more than just being a patient. And then you also want to be really clear about what your needs are, and before you come to a visit. So that means writing things down. And don't assume that your care team is going to ask you the things that you need. So a good area, an example of this is sexual health. Is that we know that very few of the providers talk about sexual health. However, it's very important to patients. And so, I think it's important that individuals will need to know that where we are right now is that your teams will probably help you if you tell them, but you might need to initiate some of those conversations.